What does the evidence say about TENS for erectile dysfunction? This video is for information only and is not medical advice. We do not provide instructions on TENS use for erectile dysfunction. Always speak to your GP or urologist for personalized guidance. Erectile dysfunction can feel isolating, but exploring your options with proper medical support is what matters. You may have heard about TENS units being used for ED, so let's look at what the evidence actually tells us. First, let's be absolutely clear. TENS therapy for erectile dysfunction is not a recognised first-line treatment. It's not part of NHS or NICE guidance, and the evidence behind it is still very limited and preliminary. So what is a TENS unit? It's a small battery-operated device that sends low-voltage electrical currents through electrodes placed on your skin. Originally designed for pain relief, some researchers have explored whether it might influence pelvic nerves involved in erectile function. The theory is that electrical stimulation could potentially affect nerve conductivity and blood flow in the pelvic region, but these mechanisms remain theoretical when it comes to treating ED. The evidence we have comes from small studies with mixed results. Some research has looked at TENS specifically for neurogenic erectile dysfunction, where nerve damage is the underlying cause. But overall, the data is preliminary and not robust enough to recommend TENS as a standard treatment. Here's what's really important. TENS units are designed and licensed for pain relief. Using them for erectile dysfunction is outside the manufacturer's intended purpose. If you're considering TENS, there are critical safety points you need to know. TENS is contraindicated in certain situations. You should not use it if you have a pacemaker or implantable defibrillator, if you have epilepsy or over areas of malignancy or broken skin. We won't cover electrode placement or device settings in this video. If TENS is appropriate for you, your clinician will provide specific instructions. Never attempt to use a TENS unit for ED without professional guidance. Before you even think about trying TENS, you need a full clinical assessment. Book an appointment with your GP or ask for a referral to a urologist. Erectile dysfunction can be caused by many different things, from cardiovascular issues to diabetes, hormonal imbalances, psychological factors, or medication side effects. Your clinician may assess cardiovascular risk as part of your ED workup. Identifying the underlying cause is essential. Your doctor can discuss established treatments with you. These include PDE5 inhibitors like sildenafil or tadalafil, lifestyle modifications such as exercise and diet changes, stopping smoking, reducing alcohol, and psychological therapy if needed. These are the treatments with solid evidence behind them. If TENS is something you want to explore, it should only ever be as a complementary option alongside conventional treatment, never as a replacement. And it should be done under professional guidance. If appropriate, your clinician will advise on UKCA or CE marked devices and manufacturer instructions. When should you seek help? If you're experiencing erectile dysfunction, speak to your GP. Don't wait. Seek medical advice promptly if you notice sudden onset ED, trauma, penile deformity or pain, or other systemic symptoms. Getting properly assessed isn't just about treating ED, it's about your overall health. So to recap, TENS units for erectile dysfunction are not a recognised first-line treatment, and the evidence is limited. Always get a full assessment from your GP or urologist first, and if you do consider TENS, it should only be used as a complementary approach under professional guidance, never instead of established treatments. Have you spoken to your doctor about erectile dysfunction, or are you still weighing up your options? Let us know in the comments. And if you found this helpful, give it a like and subscribe for more evidence-based health information from Bolt Pharmacy.